I've been following Stephanie, and I did my presentation on hourly rounding and patient satisfaction. And get my slides in here too a little bit somewhere. So the purpose of hourly rounding, as we've been learning, I've only been here a year, but it has seems like every week it's more and more important. So that's why I did my project on it. So the purpose of the hourly rounding intervention is to increase patient satisfaction through the implementation of hourly rounding, which is current at the forefront of nursing practice. Nationwide, hospitals are implementing evidence-based practice as a means of improving patient satisfaction and quality of care. I had to do a PICO question, so this is my PICO question. On the progressive care medical unit of 25 beds or more, does hourly rounding compared to traditional rounding increase patient satisfaction scores over the course of 1 year? These are the objectives: to define, describe hourly rounding, to identify the importance of patient satisfaction scores and improvement. And at the end of the presentation, participants are able to describe the 4 P's of hourly rounding. Also, how to perform hourly rounding, how to improve hourly rounding, and how to identify the patient satisfaction scores. So this is hourly rounding versus traditional rounding. We know that hourly rounding, the staff member is to go to the room every hour between the hours of 6 a.m. to 10 p.m. Needs are to be addressed on an hourly basis, as well as any scheduled medications, procedures. This allows care to be provided more on the nurse's schedule, less call-out usage. Nurses have more time to do things when they want to do them or when they need to do them. Traditional rounding, I think we normally just go in the room when they call. We spend more of our time with the needier, higher acuity patients. The other patients may feel like we're too busy for them, so they try to get up by themselves, and then they fall. So this is a procedure for hourly rounding. I copied this little article that they put up, I think on both the floors, because I really liked it, that she talked about at our meeting, how to script it, because they were talking about it a lot, but I really didn't know how to say everything that they wanted us to say without talking for 30 minutes. So this is really good. It goes through exactly what's on here. Introduce yourself. Explain to the patient during the hours that you'll be checking on them. Use the whiteboard to make them current every morning and address the 4 P's, which I'm about to explain. As I was just saying, perform each scheduled task with each round, medications, going over everything, the plan of care, so you don't have to go back in the room 20 times. Tell the patient, when you will return in the next hour, and don't leave the room in a rush. Make sure they have everything that they need. So here are the 4 P's, which are on this article as well. Pain, address pain control, ask the patient if they're in pain. Ensure that they have written on the board when they had their last pain med, when they can have it again, anything you can do non-pharmacological to make them more comfortable. Positioning the patients that need to be turned every 2 hours, make sure they're comfortable, make sure they got their pillows, turn them if needed. Ask the patient each time you go in for your hourly round and they need to go to the restroom. And ensure that everything that they're using, their call bell, their drinks, and everything is in reach and not across the room before you leave, because they'll be calling you for that. So positive effects for nurses. Definitely decrease call-out usage, decrease falls and adverse events, more time to attend to serious needs of other patients, and more time for charting, and also increase satisfaction with their care. Also positive effects for fit patients, decrease adverse events, increase satisfaction. continuity of care. The patient feels that they're educated on their care plan. I know when I do the rounds and stuff, almost everyone says they know exactly what they have planned for the day. Patients also report decreased fear of being in the hospital and increased reliability of the staff. So this is an implementation at our hospital. We do the hourly rounding sheets that we know about. I guess all staff can do them as far as I know still, but nurses are held accountable and they turn the sheets in as evidence of compliance. The compliance is monitored daily with the leadership rounds. Non-compliance warrants intervention by the nurse leaders, and it's discussed at every staff meeting. Nurse leaders. Okay, here's a couple articles that I got evidence. In this one, Marie Hutchings examined 9 studies specifically aimed at patient satisfaction. In 8 of the 9 studies, researchers found improvement in overall patient satisfaction after implementation with hourly rounds. Said patients were likely to recommend the hospital and were satisfied with anticipation of and attention to personal needs and timeliness of nurses' response and pain management. In the second study, it was a study of 335 telemetry patients, also reviewed by Marie Hutchings, in which patient satisfaction increased after implementation of hourly rounds. Next one is a study of med-surg tele-patients in West Valley Medical Center, where at least 300 med-surg patients were surveyed by the HCAPS and the Gallup organization, and 72% reported hourly nurse rounds. With hourly nurse rounds, they felt that they could always receive needed assistance. This one was in a 4-quarter HCAP survey, which I think we do here. In their 3rd quarter after implementation of hourly rounding, they were rated 3.6 on a 4-point scale for patient satisfaction. And this is some stuff that I got from here. This is one day doing hourly rounds where 7 out of 9 patients reported, rounded on by the nurse leader report, increased satisfaction with the hourly nurse rounds and that the nurse was checking on them every hour. This one I got from the Press Ganey survey that they do here from 3/31 to 6/30 this year. 70% of patients reported nurses check on them every hour. I think that was from this unit. So, this is in here. So the conclusion, purpose of hourly rounding is to reduce patients' families and caregivers' anxiety, ensure safety, and enhance the care experience. Points to remember about hourly rounding: compliance is mandatory. Rounds increase satisfaction for both patients and nurses. Rounding increases quality of care and satisfaction, and it's coming to be evidence-based practice. Oh, and also, I know they were talking about this at PCU's meeting. I really like these sheets. Are they going to put them in every room? Yeah. So that the patient can know exactly what hourly rounding is. They can read it themselves. They'll know who the nurse leaders are, because I don't think they really know, even though they say who they are, and I don't think they really know. But this will tell them exactly what to expect. Making these rounds helps us anticipate your personal needs and monitor your well-being on an active hourly basis. So if they read this, they also know that we're not just trying to bother them. So I think this is great.